Welcome. My name is Camille Hawkins, and I am a licensed clinical social worker in Draper, Utah. And my practice is called Chapters and Seasons Counseling and Wellness. We support people across the lifespan and specialize in perinatal work, specifically pregnancy and infant loss. I'm also a bereaved mother of a little girl, Everly Camille, who was stillborn in 2018.
And my name is Lindsay Proctor, and I am also a licensed clinical social worker and own a practice in Riverton, Utah called Serenity Recovery and Wellness, where we specialize in perinatal mood and anxiety disorders and pregnancy and infant loss.
As therapists, Lindsay and I support a lot of people who have lost babies, but a gap that we have noticed is families and friends and loved ones of those people who've experienced loss oftentimes don't know what to do, don't know how to support their loved one. So we wanted to create this video to help give you some information, some tools, and hopefully some confidence in how to support your loved one.
In our society, it's not uncommon for you to know someone or have a family member that has lost a baby or a pregnancy. And we want to provide some ideas of how you can support them and for you to feel confident in ways to show them love and support through this extremely challenging time. We know it can be uncomfortable and scary, and we want you to feel like you have some tools to help you through those moments. Psychotherapist and author Miriam Greenspan stated, "Emotions like grief, fear, and despair are as much a part of the human condition as love, awe, and joy. They are natural and inevitable responses to existence, so long as loss, vulnerability, and violence come with the territory of being human. These are the dark emotions. But by dark, I don't mean that they are bad, unwholesome, or pathological. I mean that as a culture, we have kept these emotions in the dark, shameful, secret, and unseen."
I really love that quote by Miriam Greenspan, who was born in a camp just after the Holocaust. Her parents were survivors of that horrific time. And she shares about how we as human beings deal with really difficult things and we have uncomfortable emotions, and that's just part of being human. So we wanted to, first and foremost, thank you for coming and listening to this training, because it's something that is difficult and of course brings up difficult emotions for us all.
So there is a wide umbrella that encompasses many different kinds of loss. This can include infertility, miscarriage, termination for medical reasons, stillbirth, placing a baby for adoption, and infant death.
And what we notice is not the type of loss, but the connection with the baby. And that is where grief comes. There's a quote I want to read from Jamie Anderson. She says, "Grief, I've learned, is just love. It's all the love you want to give, but you cannot. All of that unspent love gathers up in the corners of your eyes, the lump in your throat, and in that hollow part of your chest. Grief is just love with no place to go." And we really see this, whether it is a miscarriage right after someone finds out they are pregnant, or whether it is a stillbirth or a baby who dies, who has been born and here for a number of months. The connection between the parent and the child is typically very strong and typically means that the grief is deep.
So pregnancy and infant loss is a unique type of loss. It has different complications than other kind of loss. These parents don't have often the memories that a person has who has maybe experienced a lifetime with a grandparent. These are often unseen losses. The memories are going to be very different for these parents. They also are grieving future losses with these babies. So that might be in a graduation or a marriage or vacationing with these babies. Any of these experiences that they have dreamed about and wished for have now essentially been things that are just reminders of their loss.
Also, it can be a loss of relationships, opportunities to love, a detour in the reproductive story. I have an 8-year-old and a 7-year-old, and then I have a 2-year-old. And people say, "Oh, that's so nice to have that gap." And sometimes I share and sometimes I don't, that There's a little girl that is right there in that gap, and she should be 4.5. So there are a lot of reminders, and those reminders don't end.
Yeah.
So oftentimes people feel a deep loss of sense of self and who they are. People wonder, am I a mom anymore? Am I a dad anymore? What do I do with this love? There's a loss of security and safety in the world. If one day, all of a sudden, my baby can just die, what does that mean about this world that we're in? So there's a lot going on, and we see a wide variety of parents experiencing loss. And there are a lot of very typical experiences that people show in terms of symptoms. What are some of the most common ones you see in your clients?
They can be very somatic, so crying, physical illness, like getting sick more often, stomach aches, blurred vision,
being tired all the time, or not being able to sleep,
feeling like I'm in a cloud,
not having an appetite, or wanting to eat all the time, so disruptions in
appetite and sleep. Yep.
A lot of intense emotional reactions to anything, being really sad, really anxious, depressed, angry, upset.
It can feel like a roller coaster. One moment they're seeming okay and happy, and then the other moment they're crying. It can be very emotional, and we really like to pinpoint that emotions are okay and acceptable to have.
Yeah. It ties back to that connection of that parent-child relationship. Even if it was an early miscarriage, that connection could have already been very deep. And it doesn't just mean they were connected to that pregnancy for those few days. They may have been looking forward to this their whole life. They may be anticipating becoming a parent and putting a lot of thought and effort into this.
Yes, already buying items for the baby, having shoes or a car seat, and just having hopes and dreams for that baby.
So oftentimes people want to know what is normal. Oftentimes family and friends will feel concerned, and that's okay. It's okay to be concerned about your loved one who has lost a baby. But it's also important to know what is common in a grief reaction and what is maybe concerning in a grief reaction. So there's a wide range of experiences, as we have mentioned, but one thing that is sort of common knowledge is the 5 stages of grief. And we hear about the 5 stages of grief often, but what people don't know oftentimes is that the 5 stages of grief established by Elizabeth Kubler-Ross were intended for people who themselves were dying and facing their end of life. And so this wonderful theory has been applied to all of grief. And then what it ends up doing is it confuses people because their experience doesn't match up with these 5 stages. One thing that we teach always when we do grief groups is, instead of looking at those 5 stages, which are great for another population, is the 6 needs of reconciliation from Dr. Alan Wolfelt, who is a psychologist and a world-renowned grief specialist.
First need of reconciliation is acknowledge the reality of the loss. This can be so difficult because when it first happens, we are often in a state of shock. It's really hard to have that mind and body connection that this has happened. I mean, it's not unusual for your loved one to still, for days afterwards, feel like maybe this didn't happen.
And that denial is actually a protective thing that our brain does.
Yes.
Because losing a loved one is so horrific and tragic that our brain tries to protect itself. And that denial can actually give a little cushion for us to transition back into this new reality.
The second need is we want them to feel the pain of the loss, which is hard. It's hard to feel deep emotions and difficult things. And it's not unusual for us to want to stuff or put feelings and emotions away and avoid those feelings.
That sort of comes back to what we were discussing before with difficult emotions. Yeah. We're not typically used to feeling hard things or wanting to feel hard things. So embracing that pain is kind of counterintuitive. A lot of people don't want to embrace that pain because it doesn't feel good. But it is something that is actually productive because it allows us to move toward this place of reconciliation.
Right. So the third need is remember the baby who died. So this can be in so many different ways. It can be by wearing a necklace, having a picture of the baby up in the house. If you are the parent of a child that has lost a baby, it can be helpful to ask them what they need for you to help them remember the baby through the holidays. Especially, I will have clients tell me that they go to a family dinner and they want their baby to be acknowledged. Sometimes they don't know always how they want that to be acknowledged, but they do want there to be some acknowledgement. And so we want that baby to be remembered and to be thought of.
One example that I have with my little girl, her name is Everly Camille, and at my parents' house, they have pictures of all the grandkids, and I wanted her to be there. And so I decided to just share with my parents, hey, it would really mean a lot to me if her picture was there with the other grandkids. And they said, oh, we're so glad you told us because we weren't sure what to do.
Yeah.
And then they asked, could we plant a little garden in our backyard? And there's little space and there's, these cute little statues and a lily plant that comes up every year, and it's Everly's garden. And it's really, really sweet. And so asking and saying, how would you feel about this? This is an idea that I have. Also referring to the baby by name, if the baby was named or if maybe there was a nickname. Sometimes with earlier losses, there's a nickname. So how would you like me to refer to the baby if that's not clear?
One of the most important things I do in my practice is to remember the baby's name. It is so important. Okay, so the fourth need is to create a new self-identity. A parent that has gone through a loss will be changed from this experience. They will be different. They might not enjoy things that they used to enjoy, or they might enjoy new things that are different from prior to the loss. They might not be as social.
Especially for a time.
Especially for a time. Their life has been changed forever. It will be a constant in their life of remembering this baby and a part of them, essentially. And getting acquainted with that new person is important.
The next is to search for meaning. And oftentimes after loss, we question, what is the meaning of life? What is our purpose? With that new self-identity, what am I even doing here? And sometimes the search for meaning can refer to what happened and why did this happen. A lot of times people are going back to how the loss unfolded, what happened. Was it associated with a doctor's visit? Were there medical procedures? Were there things that maybe they wish they would have done? And all of those things are very, very common, normal experiences to go back and think about over and over again. That's part of this process. So a lot of times people will give advice, oh, don't have any regrets, just look forward. It wasn't your fault. But it's okay for parents to think about, is there something that I could have done? Is there something that the doctor could have done? That is a very normal part of the reconciliation process.
And it's an uncomfortable part for the person that is hearing it, because as a support system for that person that has experienced the loss, you want to help them feel better. And you did nothing wrong and this wasn't your fault. But when we look at this is part of that grieving process, and we want them to search for that meaning. It's just a part of the process.
And the last is to find support along the way, now and always. We as human beings, we need other people. And when someone is grieving, they need others to support. And here is where you come in. Hopefully, this training will help you to be a better support to that person. But they get to decide for themselves what support they need, when and how. You might just be kind of ready and available to support them if they invite you into that space.
Grieving is a deeply personal experience and can look different for many different parents. And as a person from the outside looking in, it can be alarming and can be concerning. It is important at that time to possibly reach out and get some support for yourself and get an idea of what is common for grief. Because what might look bizarre to you can be completely typical for a person who has lost a baby. When we get concerned as professionals is when someone is having suicidal ideation with a plan or an intent to harm themselves. And this is a time where you would want to reach out to, you can call 911, take your person, family member to an ER, or if they already are in current treatment, to reach out to that treatment team and get them some support.
Something that is also quite typical with grief is something called grief bursts, where all of a sudden you have an intense experience with heightened emotion, with maybe reminders of your loved one, just intense sadness, crying, overwhelm. That's really common. And that's going to happen quite a bit after the loss. And then over time, typically, they will happen
More sporadically.
Something that is important to know about grief bursts is that they don't end unless you stop loving the person that died. So we as human beings continue to love, and so therefore we continue to grieve. Although my daughter was stillborn 4.5 years ago, and I am not carrying the day-to-day anguish that I did in the weeks and the months after her loss, occasionally I'll think about her, or I'll see an elephant that reminds me of her, or it will be around the time of year of her birthday, and I'll start to think about her more and have heightened emotion around those times, around those reminders.
Definitely not unusual, even 18, 20 years later, right?
We have had pregnancy and infant loss healing circles where we invite parents to come and honor their babies. And we have had parents come who are in their 70s and they're honoring babies who died 30, 40 years ago. That love does not end. So one of the first things we recommend doing after you learn of the loss of a baby, of a loved one, is to assess your role. What is your role and what is your relationship with the person who just lost a baby? Susan Silk created a theory called the ring theory that helps individuals map out where they fall in terms of how close or how far from the loss they are. And this allows people to understand how they might be able to best support their loved one. It also helps people to understand where they can get their own support. So it may not be appropriate if you are a grandparent to share your grief and loss with the parent that just lost their baby. You're going to support them, and you have your own grief because you just lost a grandchild and your child is grieving. So you have multiple layers of loss. You might go to someone in an outer circle to support you in your journey.
We want the grief flowing outwards, not inwards towards the person that has lost the baby. It's not unusual if you especially are close to that person who has lost the baby to have your own level of grief and need support yourself. We want you to take care of yourself and to know when you as well need to reach out or to get support from family and friends. That is so important. It's also important to ground yourself and stay mindful and aware of what you're experiencing. That's a huge part of it. And knowing when maybe I am crossing that line and using the person who is in the center, who has experienced the loss, maybe too much and too often as your support system. We want you to realize you can't fix it. That is impossible. You cannot fix this for that person, and they don't need you to fix it. They want you to be more of a person standing next to them and a support system. And sometimes just being silent is enough, and providing them support through just your presence.
Sometimes there are logistical things to do. As human beings, we have needs. We have physical needs. We do need to eat. We do need to sleep. We do need a place to live.
Yeah.
We need a lot of things. And when a baby dies, life doesn't stop. And so it can be incredibly helpful if you've experienced a loss to have people step up and help out with some of the physical needs of life.
Picking up an older child from daycare, bringing over food. I think one that I like specifically is, I'm going to bring you dinner and I'm happy to bring it in or leave it on your porch. Being really specific about, what you will do, or I can come over at 3 and clean your house, or I can take your child and play with them. It can be very helpful because the person that's experiencing the loss sometimes often doesn't know exactly what they need.
Yes, when somebody has experienced a loss, there's this fog oftentimes that comes into the brain, and it means that people just can't think very clearly.
Right.
They don't know what they need. So if you say, let me know if there's anything I can do for you, sometimes they might reach out, but other times they just don't even know. So it can be helpful to check in and say, I see that you need your lawn mowed. I'm going to come over and do that.
Right.
Let me know if that's a problem.
Yeah.
Also, financial means can be very helpful. Sometimes families don't have maternity leave, paternity leave, and guess what? When a baby dies, maybe that maternity leave doesn't apply anymore. A lot of places of work don't have bereavement leave. So if there is a community of people that can put together money to support the family with funeral expenses, with medical expenses, with covering bills while families are out of work, all of those things can help bridge the time that people are really intensely grieving and don't have the ability to focus on those logistics of life.
And go to work often. Yeah. It's also not uncommon for the person that experienced the loss to not want the things that you've offered or be nervous about accepting help. It is really difficult to accept help from others. And that I see common as well in grief. If that's a pattern of that person, that pattern might still be there after this loss of just feeling bad, asking for help, or feeling nervous. So we want you to be aware that because that person did not accept your help, that doesn't mean that you did something necessarily wrong.
So oftentimes when a baby dies, people are overwhelming with their support, and that is wonderful. But what people typically share is that support is overwhelming at first and then quickly goes out.
Yeah.
And so if maybe weeks later or months later or the year, remember the year, the birthday, or the date of loss, or the time of year. Those things can be extremely supportive because after a loss, people are oftentimes in that fog, in that place of denial. There's so much support, there's so much going on. They might be kind of emotionally carried through that time. And then all of the support is gone. And that is when people really need support.
Right. It is probably the most common thing I hear about is I no longer feel supported 6 months, 12 months out, and how important sometimes even just a text message on maybe the baby's birth date can be so meaningful and so helpful.
Or the time of year, saying, I know this time of
I'm
year.
thinking about you.
You know, I'm thinking about Henry this time of year and your sweet baby.
Yeah.
You and your sweet baby.
It's not uncommon to not know what to say when someone has experienced a loss of a baby. And we wanted to share some things that our clients have reported to us that have not felt supportive for them. We also want to include that we know that most people are not trying to be ill-intentioned or harsh when they're saying these things and feel like they're making the person feel better. And again, it is something that's reported to us that it's not supportive. So some of those can include, I am worried you're not getting over this. And that implies that there should be a timeline of grief. And kind of like what we have discussed is grieving might get lighter and change over time, but that person still grieves that loss and that connection with that baby. Some additional ones are, this was God's plan, count your blessings.
The baby's in a better place.
Right. Be grateful that you were able to get pregnant. Oh, now you know that you can get pregnant, so it might be easier the next time.
At least you have other children.
Right.
At least you got to spend 3 months with them.
Right. And what are we trying to do right there is we're trying to make them feel better.
Dr. Wolfelt teaches about 3 paradoxes of mourning. One is to be able to say hello before you can say goodbye. So that means have a relationship with the baby. Hopefully, if you're able to spend time with the baby, to enter the darkness before you can enter the light, and to go backward before you can go forward. So oftentimes when people share some of these things, they're trying to pull their loved one into the light and try to pull them to move forward. So they're trying to be helpful. But sometimes this can feel unsupportive and invalidating. I really love Dr. Susan David, who you introduced me to.
She discusses a really important quote. So she says, toxic positivity is forced, false positivity. It may sound innocuous on the surface, but when you share something difficult with someone and they insist that you turn it into a positive, what they're really saying is, my comfort is more important than your reality.
So because you're here listening to us, I'll invite you to consider that. Consider the difficult emotions that you feel, and how if you're wanting to try and make meaning for that person, it might reflect back on what you're experiencing. So doing a little bit of self-inquiry related to, what's happening in my body, in my brain. How am I experiencing grief and loss? What do I believe?
Right.
And there might be aspects of the loss that you are creating meaning for. You can share those with people in outer circles. It is not your position to share your meaning and your definition and your reasoning as to what happened to the people on inner circles, even if you share the same faith and belief system. So here are some things that you might want to say, and maybe you practice these first.
If you're going into a situation or you're going to see this person somewhere, having an idea of what you might say is important.
We practice these as therapists too.
Definitely.
Definitely. So some of those might be nothing. You don't have to say anything sometimes. Sometimes we're uncomfortable with the silence, so we want to fill it with words. But if instead we can just be silent and just use our body language and our facial expressions to show love and concern, that can be huge.
It can be, I'm so sorry and I love you. It doesn't need to be more than that. It can just be concise and to the point.
Oftentimes we hear that people don't like to be asked how they're doing. Mm-hmm. But this is tricky because we all as a society ask that. How are you? How are you? How are you? How are you? And so we've started kind of brainstorming, what are some other ways that we can ask that question? Maybe you can ask, how are you doing mentally and emotionally? Because oftentimes, people are expected to say, oh, I'm doing fine, right? So then it feels like, oh, wait, but I'm not fine. So if you ask specifically, how are you doing mentally and emotionally?
They know what you're talking about.
They know what you're talking about.
Mm-hmm. Asking the baby's name. I think we get fearful of that. I have a lot of people that will a lot of parents that will tell me, I run into someone that hasn't seen me in a while, and I know they know, but they don't want to ask, or they don't want to ask me anything about the loss. They just brush over it and avoid it. Mm-hmm. It's okay to ask the baby's name.
Yeah. I'm so sorry for your loss. Did your baby have a name? Anything that is shared with you, you can say, thank you for sharing this with me. Thank you for allowing me in this space. Thank you for showing me pictures. Thank you for allowing me to meet your baby. If you have a loved one who has a baby at home or at the hospital and you're invited to come, I strongly encourage you to go, because this is the only time that you will have the opportunity to support your loved one in this way. And seeing a baby who has died, for most people, is not a fun experience. Mm. A baby who has died doesn't look like a baby who is living. So it can be uncomfortable because we outsource death to funeral homes and wonderful morticians. We're not used to these sights and sounds and smells sometimes. And so going into a hospital room or a birth center where a death has occurred, it can be really, really uncomfortable and scary. But if you feel like you are up for it and you have been invited, I really encourage you to do it.
Yes, showing that support in that way, even through your own discomfort and probably nervousness of that experience. Something else that is okay is to not know what to say. And it's okay to verbalize that as well, of I don't know what to say, and I'm here for you, and I'm here to listen. It's okay to be human and transparent. We don't have all the answers, and I think a parent would rather hear you be human and say, I don't know what to do in this situation. Teach me or tell me, would be way more helpful than coming in and telling them what might be meaningful for you.
You can also just let them know that you're thinking about them.
Yeah.
Let them know that you love them and say, I don't expect you to respond. No need to reply. Those kinds of things can be really great, because when you have experienced intense loss and there's so much going on, maybe a birth and a funeral and family coming into town and you're recovering from a C-section, there's so much. And so although it can be great to have that support and a community coming together, it is also overwhelming if a person is expected to reply and have individual conversations with each person within a specific time frame.
It can add pressure. You can even identify someone else in your family to respond to those text messages if that's really important. It's not personal if you're not getting a response back.
Another thing that you can do is you can offer, if you are very close to the person, to be a liaison for the community, to help set up meals, to help manage childcare if there are other children,
text messages,
to manage communication with other family members. Ideally, that person is not one of the parents. Sometimes if there are two parents and there's a birthing parent and a non-birthing parent, we say, okay, the non-birthing parent, you have all of these responsibilities because you didn't just give birth. That parent is grieving too. And so that's another thing, is to make sure that you reach out and put your arms around all the parents, not just the one who experienced or carried the pregnancy or birth. Dr. Wolfelt shares 11 ways that we can companion those who are grieving. The first is to be present to another person's pain. That companioning is not about taking that pain away. That companioning is about going to the wilderness of the soul with another human being. It's not about thinking you are responsible for finding the way out. It's about honoring the spirit. It's not about focusing on the intellect. It's about listening with the heart. It's not about analyzing with the head. It's about bearing witness to the struggles of others. It's not about judging or directing these struggles.
So companioning is also walking alongside them and not about leading them. It's discovering the gifts of sacred silence, and it is not about filling up every moment with words. Companioning is being still. It is not about frantic movement forward. It's respecting disorder and confusion, and it is not about imposing order and logic. It's about learning from others, and it's not about teaching them. It's about compassionate curiosity. It is not about expertise. A quote by Maya Angelou says, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." Them feeling supported by you and that you care is so important. And that is not always through words, and it can just be through your presence. As therapists, it's common for us to encourage those parents that have experienced the loss to enforce boundaries. And sometimes it can be hard as that person that is receiving the boundary to not take it personally or feel hurt by them. And we would encourage you to be open to allowing some of these boundaries to come in and let that person heal how they need to be. Some of these boundaries can consist of them not wanting to go to maybe a baby shower, not wanting to show up to an event that is a kid's birthday party or any social event, just in general.
Family parties, the holidays are oftentimes hard because there's a lot of family gatherings that can just be really overwhelming.
We discussed this earlier, but not taking offense to them not responding to text messages, that's not unusual. Respecting the boundary of wanting them just to have you listen and not fix it for them. We encourage you to ask what they feel comfortable with in regards to social media and posting about their baby or posting about the loss. That can feel extremely private for the person that has experienced that loss. It can feel intrusive when someone doesn't respect a boundary and posts about that traumatic loss without their permission. We want them to have a space where they do feel comfortable, that they can enforce boundaries or express boundaries that are important to them and that they can be received by the other person. We teach that actually boundaries improve relationships. They're what creates trust between two people. If a person knows that I can say no to a social event or I can say no to a baby shower without pushback or guilt, in that moment there is a an improvement in the relationship. There's a connection. There's a, I can trust you. I can trust you with my hurt and my sadness and my needs in this moment.
It gives an acknowledgement that you respect and care for me enough to respect my boundaries and what my needs are in this current moment. And sometimes those needs and boundaries might be confusing. It might be a little bit bizarre.
And to not take it personally is so important, because the person that is experiencing that loss, it's really not about anyone else. It's about what they're going through and finding a way through it and finding a new way of finding that self-identity and what feels okay for them. So after a person has experienced a loss, you might be curious if that person is going to have a future pregnancy or their plan to further their family. And this might be one of those times that a person enforces one of those boundaries and doesn't want to talk about that, or has not even made up their mind regarding that. And so we encourage you to be sensitive and aware that that might not be on their mind. And the thought of that can also be very disruptive and discouraging for the person.
So as curious as you are, if you can, try and hold that in and just support the person with what they're experiencing right now.
I think that also we can take into consideration the role that you play. If you are a coworker, I would really encourage you to hold back on that question. It might look different for a closer family member, but that it really needs to be based off the person that has experienced the loss and leaning on them to tell you what is appropriate for them.
And sometimes when others ask us about pregnancies and future children, it's oftentimes not something that's because it's supportive to us, it's because of their curiosity. Or are they going to be a grandma again, or an aunt or an uncle? And so it's not always the best way to support the person who's experienced loss.
And if they do go on to have a future pregnancy, it is not unusual for us to see them not want to announce that pregnancy, not want to discuss the pregnancy. It can feel very triggering to have someone ask, how's the baby doing? For that person, they don't know how the baby's doing. They can't look inside and see how the baby's doing. And so really, again, leaning on them to tell you what is okay and what is not okay for them, and not getting hurt if they have not told you about their pregnancy.
In pregnancy after loss, oftentimes people don't want to prepare with clothes and cribs and car seats, and they want to wait because until that baby comes home, or sometimes with a later death, sometimes there's just a lot of unknown, and that's okay. So it can be helpful to ask, can I get you a gift? Do you want to have a baby shower?
I think we always want to encourage just doing your best, and we also teach and encourage the clients to know that people have good intentions. But we are hoping with this class that there is some education and some more tools, and that you feel more equipped as that person that can support the person that has experienced the loss.
And ultimately build your confidence that you know that you can walk into a space, or you can engage with a person who's lost a baby, and know that you can be a support to them, even though you don't know all of the answers.
Or even though you feel uncomfortable. We want to thank you guys so much for listening to this and wanting to gain some education on how to support your loved one through this really difficult, hard time. We know this is a hard topic and it can be difficult to know what to do. We have included some resources below for you to get more education on and continue your education on how to help someone through this really traumatic experience.
As therapists who specialize in perinatal loss, we support a wide range of families. And if you have found this to be helpful, we invite you to donate to our scholarship fund that supports families to receive individual counseling, couples counseling, and educational grief classes to help them as they navigate the loss of their babies.